So before we get into the cardiac cycle, we're going to do a small anatomy review of the circulation of blood between the heart and the lungs. It's going to be important to understand some basic anatomy before we get into the graphs that are going to depict what's happening in different parts of the heart. We're going to split the heart here into its four chambers. So two lines here. Here we have the right atrium. Here we have the left atrium. Here we have the right ventricle. And here we have the left ventricle. Here we know we're looking at the left side of the lung, or the left lung, excuse me, because we have our cardiac notch. So the heart would be sitting somewhere here, right? So the blood comes into the right atrium, we know. But before we look at the circuit of blood, the circulation of blood, let's put in a couple valves. The atrioventricular valves here between the atria and the ventricles. We have a right atrioventricular valve and a left atrioventricular valve. The right one we call the tricuspid valve. I like to remember that with R in tricuspid here for right. The left atrioventricular valve, or the left AV valve, is the mitral valve. And just as simply, I remember that with the L for left. Then we're going to put in two more valves. One is going to be from the right ventricle to the pulmonary arteries, and that's going to be the pulmonic valve. Pulm for short. And then from the left ventricle to the aorta, we've got the aortic valve. So those are easy to remember. The blood, so let's look at the circulation of blood. Blood's going to come in from the venous system of the body to the right atrium. It's going to be pumped, and it's going to passively go down its pressure gradient through the tricuspid valve into the right ventricle. The right ventricle is responsible for pumping blood through the pulmonic valve to the heart, or excuse me, to the lungs. It's going to go through the pulmonary arteries to the lungs to receive oxygen and be reoxygenated. Blood then, let me actually put in here pulmonary arteries, and so then blood is going to leave the lungs and return back to the heart to the left atrium. This is going to be through the pulmonic veins. Veins we use to signify anything that is returning blood to the heart, and arteries we use to signify anything that's carrying blood away from the heart. So our blood is now in the left atrium. It's going to be pumped actively, and it's going to also passively flow down its pressure gradient to the left ventricle. The left ventricle we know is a powerhouse of the heart. The thickest muscular wall of the heart is going to be found in the left ventricle, and that's because the left ventricle has the heaviest burden. It's going to be the one that's pumping the blood to the rest of the body, out the aortic valve into the aorta, and resupplying oxygenated blood to the tissues and the organs of our body. So I want to take a moment to look at the graph that's going to be our best friend in the next few videos. This graph we're going to see in two different versions. The first version we're going to see is a volume version of volume on the y-axis, and the second version is going to be a pressure on the y-axis. In both situations, the x-axis is going to be time with units of seconds. The termination of the x-axis is going to be at 1 second, and this is not arbitrary. We choose 1 second because a person with a normal heart rate of 60 beats per minute will equate to 1 cardiac cycle in 1 second. So it really does make quite a bit of sense to choose 1 second as the termination of the x-axis. The y-axis, when we're measuring volume as it pertains to time, it's going to be a little more intuitive for us. We can sort of imagine the volume changes in the heart. So as the heart pumps blood from the left ventricle to the aorta, for example, we can imagine that the blood leaving the aorta is going to cause a volume change in the ventricle and the aorta. So volume is going to drop in the ventricle but rise in the aorta. And the difficult aspect of the cardiac cycle to understand is the pressure changes. And, pressure is really what drives volume changes, so it's very important to understand, very important to grasp, but it is the difficult one of the two. So I want to introduce a few concepts before we move on. Number one is, how do we get these pressure changes in the heart? And that begins with an electrical conductance. Right? So the heart has an electrical activity that is going to cause contraction. This electrical activity we measure all the time in EKGs, right? So we've all seen EKGs before, and the electrical conductance is measured on EKGs. This electrical conduction is going to cause contraction of the heart muscle in certain spots depending on what is stimulated and what is not. Excuse me for this handwriting. This contraction then in turn is going to cause pressure changes. And pressure changes are what's going to, these pressure changes in different chambers of the heart are what is going to drive volume changes. Something else I want to introduce really quick is just a rule that we're going to live by. In the normal person, all heart valves are unidirectional, meaning these valves are only going to open in one direction. And this is important because as pressure changes, we want valves to open and shut according to where we want the blood to go. So again, this rule, all valves are unidirectional. And we know that direction just intuitively by knowing the anatomy. So we want the blood to go from the left ventricle to the aorta. And so the aortic valve is going to open in the direction of the aorta. And then, so I want to look at two different examples really quick of pressure changes. Let's say we have a pressure in the left ventricle that is greater than a pressure in the aorta. What's going to happen is the aortic valve is going to open and volume is going to go through the aortic valve in the direction of the aorta. And when I say volume, what I mean is blood. And so we have a volume change from the left ventricle to the aorta. Another example, let's say we have a left ventricle pressure that is greater than a left atrial pressure. Okay. We are now going to see, because of this unidirectional aspect, we're going to see the mitral valve close, and we're not going to see a backflow of blood in the direction of the atrium. So this is important. Now we have this aspect of directionality to the blood flow. And then let's look at the opposite real quick. So if the left ventricle has a greater pressure than the left, or I'm sorry, a lesser pressure than the left atrium, what's going to happen, it makes sense, is the mitral valve is going to open and we're going to get a flow of blood from the left atrium to the left ventricle, and the left ventricle is going to fill. And then finally I want to introduce, or reintroduce to you, two terms that you've seen before, systole and diastole. Systole we can translate in our minds as contraction. Diastole we can translate in our minds as relaxation. I'm going to be using these words quite a bit, and when I say systole, or when I say diastole, what I'm really referring to is what's happening in the left ventricle. So the left ventricle really is the powerhouse of the heart, and so I really should be referring to that as ventricular systole or ventricular diastole, because we also have an atrial systole and an atrial diastole that occur at different times. But this is sort of a vernacular issue that we always sort of abide by. So when I say systole, what I mean is ventricular contraction, and when I say diastole, what I mean is ventricular relaxation. And we'll stop there and let's go ahead and get into the videos.